Hello, my name is Brittaini Milner, and I am an LMSW currently practicing counseling at Grand Peaks. I've been there since August of 2019. Today, I'm going to talk to you about EMDR therapy. You may have heard this from a friend or a family member, or maybe even a therapist has talked to you about it in the past. I'm just going to give a basic overview today on the therapy itself and what you can expect if you do go through with this therapeutic modality. The history of EMDR started in 1987 with Dr. Francine Shapiro, and she was taking a walk one day and observed that her eye movement can reduce the intensity of disturbing thoughts. And she found through this walk that using rapid eye movement actually decreased the negative emotion and unpleasant memory that was associated with that. So after this discovery, she started studying a little bit more. And in 1989, she started having quite a bit of success with EMDR in treating specifically trauma in patients and patients who have been diagnosed with PTSD. In defining EMDR, is called eye movement desensitization and reprocessing. In this, you use bilateral stimulation through audio or through tapping, or through the therapist who might move their fingers back and forth. And we'll get into that in a couple minutes. It's also used to heal symptoms related to trauma and other emotional conditions. It is also the most effective and rapid method for healing PTSD. The process of EMDR, we're going to go through the 8 phases here in a minute, but to expect the process of it, first, it allows a client to process through an emotional experience and a disturbing memory associated with that experience. As mentioned previously, it uses bilateral stimulation, so the right to left eye movement, or tactile stimulation, or sound, which repeatedly activates the opposite sides of the brain, which in turn releases the emotional experiences that are trapped within the nervous system. After this process, it unlocks the negative memories that are stored with that disturbing memory and emotions stored in the nervous system, and then helps the brain to successfully process through that experience so it becomes so not disturbing. EMDR makes it possible to gain the self-knowledge and perspective that will then in turn enable a client to choose their actions rather than feeling that the powerless over their reactions that tend to come with trauma. So going into the 8 phases of treatment, you will usually see that your therapist, an EMDR trained therapist, will treat this within 8 phases. In the first phase of treatment, on your first session, you can expect to go and talk about your history and develop a treatment plan, kind of like you would do regularly with your therapist on your first meeting time. And then on your second session or second phase of treatment, this is where the therapist makes sure that the patient or you, whoever your family member, is emotionally and mentally stable first. If they're not at this point and stabilization is required, further stabilization, the therapist will ensure that this happens here. They want to make sure that you're grounded, that you're not super activated at this part, and that during this phase, you can learn how to ground yourself when those disturbing experiences resurface, because that can be kind of scary. And so this makes it to where you're learning the skills to help yourself feel grounded throughout the process. On the third phase, a patient will identify the traumatic target or memory that comes to mind that the overall disturbance is associated with. This is where you talk about it, you relive it, and this tends to be the hard part because you're reliving that traumatic memory, but the therapist will make sure that you're stabilized and that you know how to self-soothe and be able to feel safe in that moment as you're working through that traumatic memory. So you will be safe. The fourth phase is where EMDR is utilized. This is where that bilateral stimulation comes into play. The therapist instructs the patient to follow the object, or in my case, I use just 2 fingers from here to here, back and forth as a bilateral movement with your eyes that move from side to side. While the patient follows this movement, he is told to identify a thought, feeling, or physical sensation, possibly an image, a memory, or any change of those above. Any of those that come to your mind, you're told to process through those as the bilateral stimulation is happening. Then the patient focuses on this thought and begins a new set of eye movements as you're focusing on that thought. The therapist might ask from time to time about the patient's level of distress during this. How much level of disturbance do you feel when you're talking about that memory? What is your level of disturbance between 0 and 10, 10 being the highest, 0 being not much at all, with that memory or that thought or that feeling comes when you talk about it right now. They'll have you kind of gauge that in that moment. Once you process through the memory, then in the 5th phase, the therapist will ask the patient about the validity of the positive cognition. Now, what this means is in EMDR, you tend to have a negative cognition that has formed through the traumatic event. The therapist helps you find and identify the positive cognition in opposite of the negative cognition. And that is here in the 5th phase where you either tap that in or soothe it in for yourself, hoping that that disturbance level will go down that has been associated with that disturbing memory. In this phase, the patient's target image or memory in your mind should have changed dramatically after phase 4. In the 6th phase, this is the evaluation or the patient's evaluation of pain, stress, or maybe even discomfort within the body. This is the body sensation. Maybe you have a pit in your stomach. Maybe you feel like your brain is just moving back and forth. Whatever that body sensation is, maybe you feel like you're sweating or your hands are clammy. This is where we kind of address that. Whether or not any of it's present, the patient is then asked to concentrate on that specific pain, that specific area that is being targeted. Then new sets of EMDR are issued at this point to get that level of disturbance again. In the 7th phase, this is the debriefing stage where the therapist gives appropriate information and support, maybe some feedback, maybe noticing some things that maybe you didn't notice, even during the session. Sometimes I've had patients who have maybe expressed a specific trauma, and I can see it in the way that they're moving or the way that they're expressing themselves by explaining that memory. And I'll tell them that here in this phase. And then in the 8th and final phase, this is the reevaluation stage of the previous session. The EMDR focuses on the past, the present, and future aspects of this dysfunctional stored memory, and we make a target sequence plan together, and that's what we follow after this part. The advantages to EMDR. The first, it's very time efficient. EMDR can be done within these 8 phases, but it can be done even sooner than that, depending on what that specific target memory is, or depending on how many you have. If you have more disturbing memories, it usually takes more sessions as we want to address each one individually. However, as you're going through one specific memory, if another target memory comes, we kind of have you put that away in your container is what we call it, until we address it at a later time. So we can get through one specific target memory at a time. EMDR also allows patients to shortcut the process and go to the releasing stage, which can be really helpful. And when you're going through a traumatic event, you don't want to go through that trauma and that disturbing memory for a long period of time. So it can be nice to get to the releasing stage and feel like that disturbing level has decreased. And finally, the long-term results affect all aspects of a patient's well-being so they can return back to their normalcy and health. There have been people that I've seen that have had stored trauma memories for years, and they've tried EMDR, they've come in for EMDR, and they're able to release that, and the disturbance of those memories decreases, and it improves their life drastically. There are some frequently asked questions that come with the EMDR therapy. Starting with, is EMDR a one-session cure? EMDR is not a one-session cure, but the number of sessions depends on the specific problem and the client's specific history. Sometimes repeated studies have shown that a single trauma can be processed within 3 sessions in 85% of participants throughout studies of EMDR. So it can be very effective. Not necessarily one session, but you're looking at 3 to 8 if you have one specific trauma memory. Second question, can EMDR be used to treat children? Yes, it can. EMDR has been used in treating children with a variety of conditions who've experienced trauma and complex trauma. And there are different ways that you can use it with children, a lot of which are tactile or visual stimulation that we have. I use different things to allow them to help them find coping skills, as well as be able to find their positive cognition that we're trying to work through to decrease that level of the memory. How many sessions with a therapist before the client begins EMDR? This depends on the client's ability to self-soothe, as we talked about, to ground themselves to get to a good part of being able to talk about the trauma, and use a variety of self-control techniques to decrease the potential disturbance. This is very, very important in EMDR, to be able to learn how to self-soothe so that when you're activated, you're able to ground yourself again. Will the patient live the trauma as intensely as before? No. Although there's a high level of intensity, it only lasts for a few moments and then decreases rapidly as we work through the eye movements. And lastly, is EMDR the same as hypnosis? This is a question we get quite frequently, those of us that have been trained in EMDR. The answer is no. Like psychoanalysis, EMDR can be an evolving theory about how information is perceived, stored, and then retrieved again in the human brain. And a specific treatment method is based on this theory. And secondly, EMDR does not involve relaxation, whereas hypnosis focuses on that relaxation first. So if you or a family member or a loved one or somebody that you know is struggling with a traumatic event, which in our lives, we all deal with trauma. We might define trauma differently, but we all experience trauma at some point. And it's okay to go talk about it. It's okay to get the help so that you don't feel trapped in that sensation or in that memory or disturbing thought. And if you are, contact us. We would love to help you work through that trauma. Thank you so much for taking the time to review today. If you would like and you want to learn more about EMDR, there are several animated videos that are on YouTube that you can find that give the little bit of information more in a quicker response through visual that you can look at. Or emdria.org also provides information that you can go and look through as well. Thank you.